be doing a bedside assessment today. Before I come into the patient's room, I'm going to look for any signs indicating if she's on any precautions. When I enter the room, I'm going to look for any environmental hazards. Then I'm going to wash my hands and introduce myself. Hello, my name is Sarah. I'm going to be your student nurse today. Can I verify your full name, please?
Jessica Payne.
And your date of birth?
6/10/1990.
And do you know what day it is?
Thursday.
And do you know where you are?
John Tyler.
Okay. So patient is alert and oriented ×3. I'm going to note that the patient is in a comfortable lying position and that her facial expression appears to be calm and relaxed and that she appears to have good hygiene. And then I'm going to go ahead and take your vitals, which is going to be your blood pressure, your temperature, your pulse ox, your respiratory rate, and your heart rate. And then I'm going to go ahead and ask, are you in any pain right now?
No.
Okay, so we're going to rate that at a 0, but if you were in any pain, we would describe it using old cards. And then I'm going to go ahead and test your pupils. Alright, so Perla is intact, and each pupil is about 3 millimeters. And patient is able to maintain eye contact, and her speech is clear and logical. And are you having any difficulty swallowing lately?
No.
Right. So if she was having any difficulty, I would do a swallow test with her. And can you feel me touching your legs?
Yes.
And your arms?
Yes.
Okay. So patient has full sensation in her extremities, and there is no facial droop or ptosis noted. And okay, so I'm going to go ahead and listen to your lungs. For the sake of this, we're just going to say her respiratory rate is 16, and it appears to be effortless. Sit up. Alright, so lung sounds are clear bilaterally, and there are no wheezes or crackles heard. And can you go ahead and take a deep breath and then cough for me? So the patient did not produce any mucus, but if she did, we would measure how much came out and what the color was. And then we're also going to check for any signs of cyanosis or clubbing. And there's that. And while I'm here, I'm just going to check for cap refill too, which is less than 3 seconds. Now I'm going to go ahead and move on to your heart. So I'm going to start by listening to the apex of the heart for 1 full minute. S1 and S2 sounds are heard with no extra sounds, and then I'm going to compare her radial pulse to her apical pulse, and there's no deficit noted. And then I'm going to go ahead and listen at the aortic point, the pulmonic, Erb's point, the tricuspid, and the mitral. And then I'm going to go ahead and do the same thing with the bell. Alright. And then I'm going to go ahead and compare your radial pulses. Bilaterally at a 2+, and then I'm going to do your dorsalis pedis pulses, which are even bilaterally in 2+, and then your post-tibial pulses, which are even bilaterally in 2+, and then I'm going to check for any pretibial edema on both legs. There's none noted. I'm also going to assess the temperature of her extremities bilaterally, and they're even and warm. And then note her overall skin tone is even and appropriate for her race. I'm also going to note that her skin temperature is even bilaterally. Her skin is warm and intact and dry. I'm going to check her skin turn, which is elastic. And I'm going to note that she doesn't have any lesions. Then we're going to check her symmetry, starting with her head, going all the way down to her feet, and the patient appears to be symmetrical with no deformities. And can you go ahead and raise your arms above your head for me, and then come down and cross them? And you can relax your arms, and can you bend your knees for me, and then straighten them again? Okay, so you have a full range of motion. I'm also going to check, can you push up on my hands for me, please? And then push down. And can you squeeze my fingers? Thank you. And can you push up on my hands, please? And push down. Thank you. So, patient has 5 out of 5 strength in all of her extremities. Now I'm going to go ahead and note that the contour of her abdomen is flat, and she appears to be in a good nutritional status. And have you been tolerating your diet well, okay?
Yes.
Lately? Sorry. And have you passed gas recently?
Yes.
All right. And did you have a bowel movement recently?
This morning.
Okay. And I'm going to go ahead and listen to her abdomen. Starting in the right lower quadrant, make my way around. Bowel sounds are present in all 4 quadrants. I'm going to go ahead and use light palpation and note any masses or tenderness that I see. Do you have any tenderness? Okay. Alright, and have you voided recently?
Yes.
Okay. And if we had a sample of your urine, we would note the color, clarity, and quantity. And I'm going to go ahead and check if the patient is on bed rest, and if she is, I'm going to make sure that she's turned every 2 hours. If not, if she wanted to move to the chair, I would assist her with that, note any assistance that she needed, and note any assistive devices that she used, such as a walker. I would also note if the patient was on any oxygen devices, such as a nasal cannula, and make sure that it was placed correctly and that the oxygen flow was correct. And then I would check any IVs that she had, make sure that the correct medicine was being used and the correct flow was being used. And I would also check the site to make sure there was no signs of erythema or infiltration. I would also check if the patient had a catheter in place and that the tubing was not kinked and that the bag was secured to a non-movable part of the bed and that it was in a low position. I would also check if the patient had any dressings and make sure they're dry and that they don't need to be changed. And I would check if the patient had any tubing, make sure that was clean and there was no skin breakdown related to that. And then I would also check if the patient was using any SEDs, TEDs, or foot pumps and make sure that they're being used appropriately. And then when I'm done, I'm going to place the bed in the lowest position, make sure that the bed is locked, make sure that the appropriate side rails are up. If the patient needs, the bed alarm will be turned on, and make sure that the call bell is within reach. And then I'm going to document my findings.